My name is Dr. Jalal. I'm here to talk about a new device or new meter that will help patient achieving better control, the OneTouch Verio Reflect meter. And I'm going to go a little bit over the specs. So when we start with it, actually, it has a mainly personal guidance, or what you call mentor. This is the only meter that has this. And this will provide guidance, and I'll show you later, insight and encouragement to the patient to encourage them if they're doing well or they show improvement in their numbers. The glucose numbers not only show it as a number, actually you can see a color sure dynamic range. Green is good, red is high, blue is low. And for a lot of patients, even though that may sound too simple, they like the color. I have patients who use blood pressure machines and they remember that their numbers are green. They may not remember the absolute number. The other nice thing that there is an application you can use that you download and you can have the numbers and actually transfer the number to your provider if you want to take a look at your reading. And it has bilingual menu, and so you can have a list in the Arabic language, which I'll show you. So when it comes to the Gulf area here, you can see, for example, you can have everything in Arabic language. So the whole specs of the machine is in Arabic. So on the left side, it did provide a guidance that the patient has low sugar, that they need to take juice and check in 15 minutes. In the middle, it did give an insight that there is a recurrence of a pattern, that maybe something changed. And on the right side, actually, is giving patient encouragement that the patient is doing well, majority of numbers on target, and to stay doing as well. Now, when it comes to the number, as I mentioned earlier, again, you have the color. So it will show you low, but also show you the blue color. When you have numbers in range, it'll show you this kind of a happy face. You can tag, of course, before meals and after meal. I'll show you that later. And then if it's elevated, you'll get the reddish color. Now, when it comes to, as I mentioned earlier, the guidance, so you can see here on the left side, for example, the glucose was elevated at bedtime. So the meter is giving guidance to the patient to consider maybe lower the number of snacks they eat after dinner. If the glucose is low, it's asking the patient to treat the low glucose and recheck the levels after 15 minutes. From an insight perspective, again, for us as physician, when we look at the download of the reading, we can see patterns. But for the patient who check the glucose, they cannot really imagine the patterns. They may not notice that, well, maybe I'm having a high every day in the afternoon. So the machine will allude it to. For example, here you can see number 65. So the meter will say that there's a pattern found, that there is a low, anything change. Now, this could be, for example, patient in Ramadan who's fasting, and in the third day of Ramadan, they found that they continue to have low glucose after iftar. What do? Well, you reduce the insulin or the fast-acting insulin dose for the iftar. And on the right side, again, the encouragement. If a patient do well, it encourage them and give them further motive to stay on the track. And not only that, actually, you can use it to track how often you check your glucose. So one thing we can do is use what's called the test tracker. So you specify that I'm going to check the glucose 4 times a day. And so if you don't achieve that, the number of frequency of checking, then it alarms you to it. And of course, if you achieve it, it will give you mainly a test goal award. Now, is that important? It is important. Sometimes patients come to you a lot of time and they will tell me, well, I'm checking almost every day. And then when you do the download, you will see very clearly that maybe they're checking 2 days a week. Sometimes patient cannot keep track of it. So this will help at least in that. When we know very clearly, especially on patient taking insulin, that the frequency of checking is totally associated with improvement in control. So having the ability to check more often and having something to remind you to check the frequency that's specified by you and the provider will help getting better control. And on top of that, it has what you call the trend 90 days. So mainly it shows you the trend and the glucose. But what it does, it's actually look at the average numbers for 90 days, but it's recalculated every 14 days. And so here you can see on the graph that the numbers are trending down as we go on in time. And on the right lower, it congratulates the patient that actually the average is getting better. Now, of course, if the average is getting higher, then again, it'll alarm you that there's increase in the trend. And so that could be associated with the need to adjust the dose up of medication or insulin, or the need to cut down a little bit on the carbohydrate intake, or maybe the patient is sick and that's causing the glucose to be elevated in the last period of time. So it'll give a patient insight how things changing. Because again, patient is not going to look at their numbers and calculate the average and every 2-3 days and decide. So it'll be easier for the machine to do for them. Now, the other good thing is, of course, the result log. So you can store 750 results, usually 4 in the screen. And then they can click on any of the results. They will see the time, the date. But not only that, you can see with it also any tag, any pattern, any indicator, any message that was given on the machine at that time. So what is tag? Well, if you look at it actually, when you check with the machine automatically set it up as pre-meal. But then you can click on it and you can choose after meal. But not only that, actually, you can choose other tags, which could be very helpful, not only for the patient, actually for the physician. So you can tag things like stress. Sometimes I'll have patients and they'll say, well, my glucose was high then, I think because I was so stressed or that. But they would not remember for sure because it was a month ago. But here now, you are in a lot of stress. There is a serious issue in the family. Yes, your numbers will go up. And then you tag it. So in the future, when we download the numbers, I will know that there's at least we have a good reason why it did happen. You can mark things mood, you can mark the insulin, you can mark the food intake, you can mark medication, and you can mark the exercise. And so this on top of all the other data that's given to you by the mentor and the messages. So all this will be embedded in this machine. And not only that, it will give you actually a summary screen. So the summary screen could be 7 days, 14 days, and 30 days. Here we see 30-day summary. And you see on the left lower corner that the summary for 30 days, there's 15 readings are low, 70 in range, and 23 elevated. But not only that, you can split it by the time of the day. So you can see in the morning, during the day, evening, and night, how many of those readings are low, how many of them in range, and how many are high. And for example, in this example, you can see 3 elevated, 3 low, and 3 in range in the night, and not most likely related to patient snacking. So you may find that the numbers go up after snacking. You may find that the patients sometimes go to walk in the night, and that's why they get low. So it will help you to see that there is inconsistencies in the numbers, especially after dinner. Now, the one large thing I really like about it is the ability to sync it with a mobile device, so you can transfer the numbers to it along with the annotation. And you can use this, the patient can look at their numbers in an even easier way on their phone device. And not only that, they can actually send it as PDF file to their provider, so I can look at the data, including the glucose and the notes, to try to make a better judgment if any change in the treatment. I have a lot of patients who come from far away, and I'm not going to bring them again to visit in 2 weeks or 3 weeks. So I ask them to chart their glucose down and send the numbers. And that sometimes is done, sometimes they don't do it. This will make it easier because they can use their meter. They will download the number on the phone, and then they will send it as attachment in the file to your email so you can look at the glucose. Now, would that make any difference? So that all sounds very nice. You have all this specs, and you have the trend 90, and you have the summary, and you have the mentor, but does it really matter? So there's really real world evidence where actually they access data on patient using the server for the OneTouch Reveal, mainly 4,000 plus type 1 and over 12,000 type 2. And looking at the data at the beginning of the start of the machine and mainly 90 days later. And what's shown very clearly that there's improvement in the A1C as you see here, but also there's improvement in the numbers and range and reduction in the hyperglycemia, and I'll show you that. So here you can see that in the first 14 days, 72% of the numbers were on target, 26% elevated, 1.2% hypoglycemic, And that improved significantly to 83% in target, 15% elevation, and without really any change in hypoglycemia. And that looking at the last 14 days of the 90 days period. So there was a significant improvement in type 2 diabetes and actually also in type 1. And if you look also on type 2 patient, the average glucose in this first 14 days and last 14 days of the 90-day period, that there was a reduction of 18 milligram per deciliter down from 157 to 139, which was quite significant. And that is associated, again, as I showed you earlier, with no increase in the hypoglycemia. So here you're able to get a better glucose with more glucose in range, less hyperglycemia, and no increase in hypoglycemia. And we know as a fact that typically when we try to do that, there is an increase in the incidence of hypoglycemia. So here using the machine with all the specs and the insightful and the guidance will help you maneuver through this and get patient to better target without increased risk of loss. Now, how long did it take the patient of time and effort to use it? Well, mainly average 11 to 20 minutes per week. So when a patient comes to you and say, no, I don't want to deal with it, tell them it only really take 11 to 20 minutes a week to put all the information you need. And this is really what they needed in this trial. And this 11 to 20 minutes per week did improve the percentage of the glucose reading in target by 8.5% in type 1 and by 11.9% in type 2 after 3 months of using the machine. So at the end, I hope I went over the specs of it and the benefit of using it, especially in more complicated patient, and especially for sure, of course, in patients using insulin therapy. Thank you very much.